Good morning, good afternoon, good evening, guys. How are you? Welcome back. Welcome back. For those who are new subscribers, welcome to this new channel. Not new. We are growing, we've grown. If you're a new subscriber, please feel at home. Just relax. This is a channel where if you've not been here, maybe this is your first time here. I would want to welcome you and tell you to feel at home, relax, sit back, be ready to learn, and just enjoy. In this channel, we normally talk about nurses. We want to enlighten each other. We want to talk about things that affect our day-to-day activities, like the things that we normally don't get the information, like things that they don't tell us and we would want to know. So it's basically enlightening each other. We normally say, what you know, please bring on the table, like comment down below, comment in the comment section. What I know, I am bringing it to you guys so that at least we enlighten each other. So today, I can't forget to say that we want to thank the Lord for enabling us. It takes the hand of God, by the way. And all the time, I normally say, I don't take it for granted that we are alive. We normally say that every day you wake up and then you find you've been from one point, from point A to point B. It takes the hand of God. So you just have to thank God. So today is a bright day. It's a bright morning here. It's in the morning. It's around 10 a.m. And yeah, we just want to thank the Lord because we believe it's gonna be a good day. And it's for sure it's a good day that the Lord has made for us, because you see, we've woken up and we are fine. So today, without even going rounds and rounds, without further discussing of whatever it is, let's talk about, we've been talking about NCLEX. In the last two videos, I was sharing my experience with NCLEX. Everybody knows what is NCLEX. It's a National Council of Licensure exam that is done by every nurse who is practicing or who wants to practice as a nurse in the United States. So anybody who is practicing in the United States must have done that NCLEX exam. So that is basically what we are trying to enlighten ourselves. And I've been sharing, or I shared my experience, how I revised for my NCLEX. The video is up. It has been running for the last, I think, 5 days. So if you've not watched it, please, if you're coming across this video or this channel for the first time, please go back to the last videos. Maybe there's something that you're going to learn from there. So today, I want us to talk about, because people have been telling me, you know what, Zippy, there's this thing that people are saying that in April, we are 3 days to April 2023. They are producing the new, we are going to have the new NCLEX generation, unlike what you guys did, the old NCLEX generation. So I thought we could maybe go through and look at the similarities between the old NCLEX generation and the upcoming, which is now the new NCLEX generation. And I thought maybe it's good for me to have some notes, because I told you guys, I always want to tell you people what I know and what I've researched on, and what you feel like have not tackled or have not touched about. You feel free to comment down below and tell me, hey, you know what, this is now the updated information, because we are learning. This thing is dynamic. There's no way you will tell me that I know everything. I'm not a know-it-all. And there's no way you will tell me that you know everything. There's something that I'll tell you today and you didn't know. You're like, oh, kumbe, that one I didn't know. So today, let's talk about the similarities between the old NCLEX generation and the new NCLEX generation. The similarities, we all know that NCLEX is a computer adaptive testing. It's a cut mode. The answer for each question determines the difficulty of the next question. If you remember when I talked about, when I was talking about SATA in the last video of how I revised for NCLEX and how my experience was with NCLEX, I said, if maybe, for example, you encounter a question and you feel like it's so difficult for you, because there's that graph that they normally say that it's based on a baseline graph, there's a baseline point of it's a graph sort of, I don't know. But now we normally say, we used to say that the more difficult the questions you're getting, the more there's a probability that maybe you're doing good. But the more easier the questions that you're getting, maybe question 1 was easy, you would even feel yo, this is a very easy question. And then the next question, number 2, it's still easier than number 1. That is what we call computer adaptive test. Like the computer is the one basing on the kind of questions, the kind of answering that you're giving. So the more the question, the more hard the question is, the more, like, that is, how do I say it? If you get an answer that is easier, it is the one that will determine how complex the next question will be. So it's a computer adaptive, like the computer is adapting to your way of thinking, your way of answering questions. I hope it's clear. So that remains the same. Both the new NCLEX generation and the old NCLEX generation will be using the same kind of testing mode or whatever it is. Number 2, the duration remains the same. According to the research that I've done, those people are going to sit for the new NCLEX generation as we sat for the 5 hours. The one that was going for 5 hours, minimum question was 75 and the maximum question was 145. It's still the same. It's still the same. There is nothing much that has changed in timings. So it's still 5 hours, computer adaptive test, 5 hours, like both are 5 hours, and both are cut mode. Then the current one has multiple questions, the type of questions that we have in the current NCLEX exam, like NCLEX generation that we have, that is now the old generation. We have multiple choices, the one that you normally have a question with 4 choices, so you're told to select one that is correct. To select one that is correct. Like for example, it's either answer A and answer B or answer C or D. Like it's a multiple question, like MCQs. We used to call them MCQs. Then you have the SATA questions. They select all that applies questions. All of them, they are there. Like in both the old NCLEX generation and the new NCLEX generation, it has both. Then you have the hotspot. There is this, maybe like you're told, you're given a diagram and then you're told there is this kind of a sound that appears in this particular point of a thoracic cavity. So identify that spot and you click on that point, and then where you click is where you'll get that the answer is. So if you're wrong, it will be an X. If you're right, you get the point. Then you fill in the blanks. You used to have the fill in the blanks, like you're told in a sentence, they give you a sentence and then they want you to identify what answer is supposed to be filled in that particular point that they've not given you a word. Maybe they are talking about medications. Maybe there is one word that explains a medication, like a synergy, like such kind of, like you fill in the blanks. It still remains in the old NCLEX generation and it's still going to be there in the new NCLEX generation. So you see there is no much difference in terms of questions. That you also have the drag and drop. This one is whereby, like you're told, they arrange answers in they rearrange the answers and then you're told to drag and drop to the correct, like the one, like, you know, it's kind of matching. Maybe like there is column A. Oh, today I don't know what's wrong with my tongue. There's column A and there's column B. So in column B, the answers to column A are misarranged. So you're told drag and drop so that you can match the answers, you know. I hope you guys are understanding what I'm saying. So those kind of questions still remain in the new NCLEX generation and the old NCLEX generation. So you'll still find, if you've been right, maybe like, you know, if it's coming up, if it's something that's upcoming, like it's something that's being introduced into the system, of course you have been revising with the notes of the old NCLEX generation. So you need to understand that there's nothing much that's going to change. The kind of questions that you've been seeing in the Q banks, they are more or less the same with the ones that you'll be seeing in the new NCLEX. So your revision is not going to change that much because you see the questions are kind of similar. We'll also have charts and graphs, like we've had charts and graphics, like we've had maybe a pie chart, you're given a graph, so you're told to identify maybe a certain year. Maybe you're given a scenario, case scenario, and then you're told this year there were these kind of conditions that appeared in year 2001, year 2002. So you're told like to draw a pie chart, a graph or something. Those people have been revising and you're revising right now. You understand what I say by saying that the charts have been there and the graphics have been there. So they are still there in the new NCLEX generation. The graphic answers, that's like just the multiple choices, and we also have the audio or maybe a video. You're given earphones. Like during my time, I was given an earphone, like a headset. Then you're told to listen. You click on a particular point, and then you listen to what you'll be like, what will be. There's a voice there's a sound that is there, maybe a lung sound. Then you're told to identify, is it a brood? Is it a wheezing? Is it a what? So those things will still be there. They're still in the old NCLEX generation, and they'll be there in the new NCLEX generation. So we've said the differences, the similarities are 3. The things that will remain the same. It's still a cut mode exam that is based on any answer that you give will determine the next type of question. So the harder the question, like the difficulty of the question, you understand, I had explained. The duration is still 5 hours for both. The current answers, all the current type of questions that are there will still be there. Like most of them will still be there, even in the new NCLEX generation. So then what are the differences? The differences are 3. The differences that we might find in the current NCLEX generation, there is that partial scoring of marks. You know, like you're either scored as a correct or an incorrect. In the next NCLEX generation, the new, we're calling it the NGT, the new NCLEX generation, you find that there is 0.0 over, like there is partial. There's partial credit, or there's the method of summation of correct and the incorrect answers. What do I mean by this? Maybe you can be given 0 point something point out of an answer that you've given. You understand? The other one was either you're right or you're not right. Okay? Then the next one, in the current NCLEX generation, we've had to memorize the lab works. Like you have to know if it is a potassium level, a correct one should be 3.5 to 5.5. You have to memorize. But in this new NCLEX generation, what I understand is there are reference ranges. For example, if my answer is supposed to be 3.5 to 5.5, if I was to give 3.2, between 3.2 and 5.1, because those are just within normal ranges, I'm still going to get that as a correct answer. The other one is case studies. In the old, like in the current NCLEX generation that we have, we don't have case studies. As we didn't do case studies, there were no case studies during our time. But in this one, there is a case study which will have 6 questions based on the clinical judgment of the examiner, of the examinee, of like the one who is doing the exam. So you're given a case scenario, and then they generate 6 questions out of that case scenario. So now the answers that you'll be given, all the answers that you'll give, they'll be based on your clinical judgment on what you're seeing from that question. I think in Kenya we used to have that kind of case study. It has not been there in the current NCLEX generation, but I understand there is there. And then for the type of questions, they've been extended. There are new types of 4 questions. Like there are new types of questions. One, there is extended multiple response. There is the matrix grid type of questions. There is extended, like that's the drag and drop. There is the close, the drop down, and there is the enhanced hotspot. Like these are the kind of differences that you find based on the domains, the 6 domains that we have. You recognize the cues, you analyze, you prioritize the hypothesis, you generate solutions, you take action, and then you evaluate. You know, like the way we normally say the nursing process. You know, a nursing process has ADPI, like the six stages of a nursing process. So it's kind of the same, because in this case, you're going to recognize the cues, you identify. You know, when you're recognizing is like you're identifying. Just have that in mind, the nursing process. Then after that, you need to analyze, okay, now because I've recognized in this patient or in this case scenario, this is the problem that we are having. This is the challenge that we're having. So I need to analyze. When I'm analyzing, I need to understand, because I need to think critically about this kind of the cues that I've identified. So now I'm analyzing, what do I need to do? After that, you prioritize. You prioritize, because now in this case scenario, maybe you're saying this patient has an airway problem. has a breathing system that has been compromised. We have a circulation problem. So which one comes first? Of course, when you do the airway, breathing, and circulation, which one comes first? The ABC prioritizing, you know. Then you generate solutions. If maybe this patient has an airway problem, what do I need to do? You know, you need to do the jaw thrust. Maybe you do the chin, you know, like you're elevating, you're trying to open the airway. If not, so if it's not happening, do I need to provide a tracheostomy? You know, like that, the kind of, you have to have an airway that is open. Do I need to intubate this patient? Will the patient benefit from intubation? You know, you're prioritizing what you need to do. Then you generate solutions. If it is maybe I have decided that I'm going to prioritize my airway, because airway comes first, and then breathing, and then circulation. I need to have fluids for resuscitation. I need to call backup, you know. I need also to get a doctor who is going to intubate or maybe provide a tracheostomy, because maybe getting an airway would be difficult for this patient. The neck is too tiny. I have compromised airway, so I need to like give a tracheostomy. So I need to get a doctor who is going to do things, because of course, you know, nurses, that is not in your scope of practice. Then you take action. Now you've already generated the solutions. You know, this is what I need. I need an ETT tube size 7.5, size 6.5, blah, 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 and stuff. I need a laryngoscope handle. I need the blades. I need everything. You've generated all the solutions. You need 3 people. You've called a backup maybe from a different unit. You know, like if it's casualty, like airway, like, you know, you have the crash cart available and stuff. Then you take action. Taking action means now you're there now. And remember, this is not a real patient. It's a case that you've been given. But you have those domains in your brain, like back in your mind, you're like, this is now, I'm trying to actualize what I imagine. If it's a real patient that I'm dealing with, this is what I need to do. So that's why you have to understand the 6 domains of the new NCLEX generation, okay? Then from there, you evaluate the outcomes. Okay, I needed to have a secured airway for this patient. We already have it. And then my team is here. Maybe the patient has developed, now we are hypotensive, we're in a hypotensive crisis. We need to give fluids because the airway is already secured. But then again, the circulation, we have low pulse, it's very thready. So what do I need to do? We need to resuscitate this patient with fluids, you know. So I'm now trying to evaluate what I've done. We started with a BP of 50-30. But we've resuscitated with fluids. Maybe we've given the isotonic and hypotonic solutions. We've given the crystalloids and stuff, the choroids and stuff. And then at the end of the day, the BPs have risen. Do I need to start an inotrope? You know, like you're now trying to evaluate the outcomes. What have we achieved? What haven't we achieved? So that now you go back to identifying the cues. Basically, this takes you back to the nursing process. If you're good in the nursing process, of course, you'll understand what it means by the 6 domains, of the new NCLEX generation. Then you also have to understand, just like the way we were doing, we are trying to tunachambua this new NCLEX generation, the similarities and the difference between the old and the new one. You also have to understand they are when we were doing the old NCLEX generation, we used to think and ask ourselves, what are the what's in these? What are the what's and what are the whys of these? Like if there is a question, do I have to ask myself, why do I need to do it? Which are the whys and which are the what's of these case scenario that have been given? It's still the same. You have to ask yourself those kind of questions. Then what remains as the priority or as the best, like what content, where are you getting the content from? The content remains the same. We are not going to be told that we are now supposed to get a med-surg, like, you know, in Kenya we use med-surg, you know, anatomy and physiology. The content remains the same. It is still Sounders. As we used to get our content from Sounders, I understand it's still the same. Sounders remains your Bible. Sounders is the Bible for nurses. You have to understand Sounders from point A to point B, just like the way I told you in the other video, guys, that we revised Sounders from point A, from page A to the last page. So even this one, it's still the same. You need to understand the content. Content lazima ukue nayo. You must have the content. So Sounders remains the same. And then your way of critical thinking is very important when you're answering questions in NCLEX, be it old generation, be it the new generation. You have to be armed with critical thinking. And there's this thing people say that, you know, if you're working in ICU, you stand a higher chance of having that critical, well, kind of in a way, but even if you're working in the wards, casualty, like emergency department, the ER and stuff, you need to have that critical thinking for you to have that critical judgment. Not even the clinical judgment, but the critical, like, you know, if you realize there's a deviation with the lab values of this patient, what do I need to do? If a patient comes and reports to you that they're feeling palpitations, you connect this patient to a monitor, you find that the heart rate is about 250. Of course, that tells you that the patient is an SVT. That's an SVT. So the next thing you're expecting is this heart will be fibrillating. There is nothing that will be getting from, like, there is no circulation, there is no supply of oxygen and supply of nutrients to the vital organs. So what do you need to do? You need to revert this system in this rhythm. You need to think of vagal maneuvers. You need to think of like the non-pharmacological means of reverting this rhythm. Then maybe you see like that at that point you don't need a doctor to come and tell you, oh, you know, Zippy, this is what you're supposed to do. You need to have that critical thinking, that clinical judgment, you know. So that still remains in the new generation and in the old generation. Also, maybe like you're given a case scenario and you're told a patient reports, or you receive a call from the lab, and they're telling you that the patient that you had drawn samples like an hour ago, the potassium is 7.1. But when you look at the patient looks okay. Clinically, the patient is okay. So you need to ask yourself, did that sample hemolyze? That is one. During the collection of that sample, what happened? You understand? You need to have that critical thinking before you start acting upon this patient. Look at the monitor. Do we have elevated, do you have picked T's, you know? Do you have, how is the rhythm? Do you have like symptoms of non-STEMI, you know, STI elevation? You know, you need to have that critical thinking. Before you act, maybe you go start giving patient, you want to bind the potassium, and in the real sense, there was a problem with collecting that sample. You understand? So that still remains. You need to have that critical thinking when you're dealing with patients, because we normally say when you're doing NCLEX, you imagine it's a patient like you have at that point. You understand? So that still remains. Content are still the same. Critical judgment, critical thinking you need to have. You need to be very sharp when you're answering those questions. You understand? Then during the revision, the question may be asked differently, but the content is the same. Like I talked in the last video, when I was doing the revision, like when I'm doing, maybe you have archers today, you're revising using archers, you've said questions like maybe in CVS. We said I love CVS. So every time I talk about NCLEX, I'll still talk about CVS. So maybe you're revising CVS, and then you find a question that is asking you, but you see, like this question, it looks so familiar, because when you look at it, it's like you've ever found it in your world. It is the same content, but asked differently. It's just that it's twisted. So you need to understand, you need to have the content so that you're able to know what kind of a strategy am I going to use to approach this question. Because it's still the same question, but set out differently, framed differently, but it's the same. You understand? Then practice and familiarize yourself with new question styles. There may be some slight changes in this new NCLEX generation set of questions, but I don't think there is much change, because during my research I realized there is not much of a difference. It's more or less the same. It's only that you need to understand what strategies are they using when they are answering, because of course you'll get those rationales. When you answer a question, maybe in a Q bank, and you're answering questions, you'll find that they give you rationales. So try to look for those questions, the old NCLEX generation questions and the new NCLEX generation questions, and identify the styles of answering. Is there a big difference, so that you're able to understand what do I need if I am doing my NCLEX exam today? What do I need? You understand? So do a lot of questions, especially if you have you've already obtained your ATT. Like that sounds like maybe you have only like 3 months for you to sit for the exam. So make sure you do a lot of questions. Question banks, guys, you need to have question banks. You can't afford to do NCLEX without having question banks. And you need to understand different styles of questions in different Q banks. Like Q banks, when I say a Q bank, you understand it's a question bank. So maybe you have a UL, somebody else has a simple nursing, somebody else has a Pearson or whatever, those question banks that you have, you need to understand their styles of answering those questions. So you need to do a lot of practices. Make sure that per day, at least per day, you get like 100 questions. Set your time properly, and then maybe with time you'll understand how they mean, or like the kind of whatever that it is they are doing. And then last but not least, guys, last but not least, remember to pray. This thing is all about like trusting yourself, doing a lot of practices, lots and lots and lots and lots of question banks. You know, do a lot of questions so that you familiarize with yourself with the kind of styles that they're using. In case maybe there are slight changes, don't rely on what you see, like what Zippy has told you, and then you just sit there and then you're like, oh, this is what I'm going to do. Okay. Anyway, guys, last but not least, I wish you all the best, nothing but the best. Trust in yourself, trust the process, and believe in us. If other people made it, even you guys are going to make it, okay? And then I think in the next video, we're going to talk about like the things that we need not to like, we don't need to get afraid of. If you hear NCLEX, what do you need to arm yourself with, you know? So without so much stories and stories and stories, see you in the next video. See ya, guys.